Ricardo, how you doing, brother?
Good, good. How about you?
Good, good. It's been a while, huh?
Yeah, yeah.
I saw that you took a little vacation.
I did. It was too short.
Oh yeah.
Too short.
So
And when I came back from work, it was done. And a few days of working on call, I was just on call, and that was it for me. I forgot I was on vacation. I need another vacation just when I came back here.
oh man.
It was back to reality.
So you went to the Caribbean?
Yeah. So Caribbean, little short cruise. We stayed around. Yeah, at least I took the kids out.
Nice. That's good. That's good. They need that for the summer, huh?
Yeah.
So so it seems like you've been pretty busy, huh?
Yes, we've been busy. Can't complain. Yeah, definitely we've been busy.
What is it that keeps you more busy, like as far as surgeries goes?
I'll tell you the truth. So sometimes I almost feel like Batman, because during the day we're doing like elective surgery, and at night then it becomes like emergent surgeries or accidents or this or that or dog bites or falls, cuts, trauma. So I will tell you it varies what's going on. But during the day, it's elective surgery, and then whatever comes in during the weekends. Like, it was 4th of July weekend. So, it was busy. Thank God I wasn't on call yesterday, so that actually worked out good for me. I got to rest a little bit. But yes, we're busy during the day and during the night.
Wow. Okay. Well, Ricardo, I have some questions for you.
Okay.
And
Let's
you
try
can, I think that you're a little prepared. But so one of the things that I wanted to ask you was, how do you handle patients who have unrealistic expectations about the outcomes of their plastic surgery procedures?
I think one of the things we have to do is really try to get them to have a realistic expectation. I think the number one thing that I try to do, at least in my conversation, is really see if they have, and sometimes, they are fixed into what they come in with. And I think the first thing that I try to do is really understand. I think everybody that comes in and talks with you, the number one thing that you got to do is they want to feel heard. You want to understand what they really want. And, once they understand, at least try to understand what they really want, then I figure out if I can really explain to them this is something that we can do considering the person's body habits and who they are and really what condition or what age they have. I can't, a 70-year-old person can't tell me they want to look like a 20-year-old person. But, we can definitely improve on some of the things that they want. So I think number one is understanding, hearing, listening to the patient and seeing what they want. And then, I try to give them an explanation based on science and kind of a basic understanding, and trying to make it simple to them that, this is who you are and this is what we're starting with and this is maybe what we can deliver, and then we try to get into. It's almost like a negotiation. I don't find myself in a situation where I'm going to convince someone and clarify them and tell them, hey, this is, what I want. I really don't impose myself into what someone wants. I try to listen to them, understand, and I tell them, in my humble opinion, this is what I can do for you, and if I can get to that understanding with someone, then I think, and if the patient meets the criteria, then we can definitely do a surgery once they have that understanding of what we can do. If I find myself with someone who has a really unrealistic expectation, or it's above what I believe that it's in my hands or my capacity, I give them the opinion, unfortunately, I can't deliver really what you want. And maybe you should seek someone else to go and have that evaluation, or I might actually discuss it. Sometimes we're in a group, being in a group practice, or some of my partners all come in, and we're sometimes in the office, a couple of guys at the same time. I'll walk them in, hey, what do you think about this? And sometimes what you hear from two surgeons at the same time and saying or this or that. Sometimes the patients come in to understand, and maybe what I want is not realistic. But there's sometimes situations where you'll definitely find someone who's fixated on an idea of what they want, and I, at least I don't feel that I can deliver that, or it's sometimes maybe not possible.
Do they come and show you pictures? Oh, I want to look like her.
Yeah, and we definitely try to, I actually encourage, I love when patients bring pictures, because that is actually, for me, a patient who would bring pictures, they already kind of have a better idea, and it gives me even a better understanding. I have patients who will walk in and they tell me, do me whatever you want, you're the doctor, and that for me is not a good thing when I find myself in that situation, because what I might believe might be aesthetically pleasant or appropriate, might not necessarily be what they believe. And I'm fairly open to to listening to people and what they want. I really don't try to impose myself. I think bringing me pictures of what you want is awesome. If you have pictures of when you were young, even better. And then we show them, and once they bring me those pictures, then I try to take pictures in our office of where we're starting with, and we give them an inventory of the patients. The patient says, like, Doc, you made me feel so bad afterwards. I didn't know that I had all these things or asymmetries, and you unfortunately have to point out all the things that they have, which are natural things. Most people are asymmetric. Your left and your right side are asymmetric, and make those notations, and most of the times when you have that conversation, you take pictures, you compare to what they want and where they're starting from. Usually you're able to get to a point where patients are happy, and most of the time you'll find with some their realistic expectations turn to more realistic expectations. And again, if it doesn't happen, then I tell them, unfortunately, I might not be the fit to the surgeon to operate for you.
I don't know if you ever heard this before, but I remember years ago, I saw this documentary that there was this patient, this girl, that she wanted to look like Britney Spears. So the plastic surgeon, okay, let me see. Obviously, there's a lot of pictures of Britney Spears, and he kind of did it. He did it, and he made her look very similar to Britney Spears, and she was very pleasant with that. But what do you think about those type of requests? Have you ever had something similar?
No, thank God I don't have anybody who tells me, hey, I want to look specifically like something. What you'll have is someone like, they'll show you pictures of someone's breast, some famous, someone who's famous or popular or whatever, and they tell you, I want to have her breast, or I want to have her nose, or I want to have something like that. They don't tell me I want to be completely transformed into this person. So I thank God I haven't run into someone who has told me that. But if they have a body habitus that is similar to someone, we can definitely try to get close to something like that, especially if it's breast or something, or maybe some improvements in the nose and the chin or something. But no, my goal is never, I think no one really should, at least my humble opinion is that no one should really change who they are. I think that's how you identify yourself. I think, what we try to do as plastic surgeon is really improve on what you have, and if we can rejuvenate you or improve or augment some things, we could definitely help with that. But usually, I think, and I think the trend is that I think most people are trending that they want that natural appearance, that younger looking appearance, and we can definitely deliver who the person is, at least.
So, in your opinion, who has the most popular breasts out of, I'm saying, like, as an actress or a singer? Who do you think that they come? You know what? I want her breasts.
I'll tell you the truth. I really what I've seen with the trend now is that the girls are asking for smaller breasts. I really haven't had anybody like tell me, hey, I want Scarlett Johansson's breast. I think bigger, fuller breast. I don't think I really have had any persons who are coming in and asking me, I want the breasts. There's a girl in particular, I'm trying to remember her name. I'm not good with names sometimes, but, with the younger models and with the younger girls, I think they say, like, I want this type of breast, and it's usually some of the younger girls. But again, the trend, I feel that is to the smaller breast size than the larger breast size. I think girls, and again, I'm in Miami, so Miami has a different view of what might be geographically in other places. And again, the Miami appearance is more of an athletic. I think girls want smaller breasts, but they want bigger thighs, more muscular, narrow waistline, maybe an athletic gluteus and athletic thighs. And I think that's the trend that I see here. That fit. If you can imagine, it's almost like the fitness model appearance that I think what we're looking at now.
Okay. Now, can you tell us about a time when you had to make a difficult decision during surgery? Like, how do you approach it, and what was the outcome?
That's a good question and a hard question to ask. In plastic surgery, ideally, when we're doing elective, and I'm going to tell you, when you're doing elective surgery, we try to visualize what we're going to do in the surgery, because we plan ahead before we'll go into the operating room, we try to make sure that we visualize what are the pros and cons, or where I can get in trouble before I do that surgery. So usually surprises in elective plastic surgery are things that we try not to run into, we try to plan for those things. You try to do it in the best situation. Want to make sure that those patients have. Again, we went over expectations. We went over medical clearance, or someone who's well nourished, someone who's not a smoker. And you try to go through those things. Sometimes you'll run into the occasion where someone had some type of surgery and they didn't tell you what to do, or and for some X, Y, or Y reason, someone would not tell you, hey, I had this intervention, and they will lie to you, or I don't want to say lie about. Let's say they forgot to tell you that they had some intervention before, for some reason, and then you were counting on doing an intervention on this, and unfortunately I'll give you an example. Some patients will say, I never had a rhinoplasty, I never had surgery, and you're expecting they're going to find something inside of the nose, and then you open up Pandora's box and you find I don't have cartilage or something like that. And usually in those situations where you had planned something, you really resort to talking about having multiple options. So I give myself multiple options when we do surgery, and when we talk about when we talk about the possible interventions. I really I realize that when we get the consent and consent for surgery, I try not to tie my hands onto something, and because some patients will be forcing me, I will not accept this scar, I will not accept blah blah blah, and I'll tell you, sometimes if a person is not going to be flexible in allowing me that flexibility of making some decisions or some minor changes or something that has been discussed, then I might probably not do that intervention and not find myself in that situation. But sometimes you find those surprises, and if you find those surprises, hopefully you've had the appropriate training to make the right decision. Sometimes it's bleeding, something like this, and if we find bleeding, you try to improve the exposure. My background is general surgery before I did my plastic surgery, so those things is number one, is you keep the calm, get the exposure, try to figure out how to stop the bleeding, communicate with your anesthesiologist. And those sometimes do happen. It's mostly in the trauma and in the reconstructive situation where, again, we're coming in for something else, not for an elective surgery. And even under those situations, sometimes people bleed, and if a person is bleeding more than expected, let's give an example, liposuction or breast surgery, you find you're just into too much bleeding, then, you have to make a decision at the time where you have to abort the intervention, I've been lucky that I don't have to run into those situations on a frequent basis, especially for elective surgery. But sometimes, we do that for breast reconstruction, where the patient, we tell them, hey, you're going to have breast reconstruction after mastectomy. But sometimes, the breast surgeon had to deal with a difficult tumor, or for X, Y, Z reason, the breast is not in the shape or condition for us to proceed with a breast reconstruction. And ideally, I had that conversation with the patient before. So I think it's good communication precludes a lot of those problems. If it's a problem that you run acutely in the operating room, usually if it's a bleeding situation, you try to keep calm and get the exposure, stop the bleeding, identify what's bleeding, holding pressure, and really feeling calm about what you're doing. After many years of training, being a plastic surgeon, I think most of us know what to do. And if you run into a situation, you can always, if there's a big surgery or something that I'm doing, usually we'll have an extra pair of hands that are going to be there, and you can definitely ask for help or help retracting or something like that. Especially for bigger cases, usually it's me, my partner, or one of our residents. So usually we're able to handle those situations. But again, you're not going to what you plan for the best, right? No. You're ready for situations like that. So I think appropriate planning definitely handles with that, and usually the outcomes are good on those situations.
Okay.
Yeah.
Now, going back to obviously afterwards. Now, what steps do you take to ensure a smooth recovery process for your patients after surgeries?
I tend, for the elective cases, especially like larger breast, like let's say, it's really, again, I think one of the trends that we've seen with pain management is we're trying to run away from the opioids or minimize the opioids, and we've been using multimodality pain management. I think that's definitely changed the way that we work with patients. We have local anesthetics as blocks that can help with immediate post-op analgesia. We can utilize anti-inflammatory agents who will also help with pain management, and a combination of maybe a short course of opioids might help. So I think a multimodality pain management helps a lot. for pain management. The other thing is really trying to minimize the amount of trauma and surgery. Again, plastic surgery is still surgery. I try not to tie myself to too many interventions at the same time, but sometimes you have to, because this is the chance the patient has. So we try to make sure that, whatever we're doing, we're not a full day in surgery, more 6-7 hours of surgery for an elective surgery. I think it's where I would stop, especially for an elective intervention. So those things all help with recovery. And again, patient selection is very important. Getting those patients ready for surgery are going to be very important to that recovery phase and getting them moving. I think ambulation, moving, walking helps getting that body and helps with the inflammation. But I think multimodality pain management helps again with the recovery of what we're doing with patients. The general surgery people talk about the ERAS protocol and all this, and even the colorectal surgeons have come out with protocols how to manage pain on patients appropriately during that perioperative period of time. And I think plastic surgery is definitely working on that way. But all of us, I think, are going into that multimodality way of how many, attacking pain management from multiple points and definitely helps with the recovery.
That's good.
And again, having a motivated patient also helps a lot. I think pain is very subjective, and sometimes, a patient is very anxious or has very difficult. You kind of know who are going to be the patients who are going to be a little bit more difficult on the pain management. And if you know that from ahead, sometimes getting them ready and helping them managing even the anxiety and things like that, definitely all of those things will help on getting them, having at least a better recovery.
Well, I went through something similar last month as far as that, because I had all my 4 wisdom teeth taken out.
Ouch. Yeah.
So I was like asking questions as far as, does it hurt afterwards? I wasn't sure if I should do it or not. If I wasn't sure if I should.
Should have done it in our office, man. One of my partners would have definitely taken care of you for that.
Oh,
we have even anesthesiologists will come in. One of my partners would have given you an anesthesiologist would have come in there and would have helped you with pain management and everything. Yeah.
Well, it went well,
Yeah.
I think.
Well, you're here.
Yes, I am. So obviously I couldn't chew for a while. Like I will say like 4 or 5 days, and it's getting better.
Mm-hmm.
But it hasn't even been 2 weeks. But yeah, you're right. It depends on how the person takes it.
Yeah.
If they're too afraid, then I guess that's not too good.
Yeah.
No,
I'm scared of dentists, and my partners are dentists. My uncles were dentists when I was a kid. My mother-in-law, my brother-in-law. I think my dentists follow me all over the place. And as doing facial trauma, I do a lot of dental surgery, so I know I'm scared of even having my wisdom teeth pulled. I've had to have some pulled, and oh my God, I know that I'm not a good patient.
Yeah. Oh man. All right.
I need to be knock me out for.
Yeah. Well, that's how I asked her that. Can you just put me to sleep? She's like, no, I can't. All right, Ricardo. So, in your opinion, how important is open communication and trust between a plastic surgeon and their patient? Like, how do you establish and maintain that trust?
I think the number one thing is really getting to know the patient and listening to a patient. I think one of the basic things that they teach you when you're a kid or in school, at least they teach you about communication. Someone talks and the other one speaks. And I think one of those things is again, people want to be listened and to be heard of. So I think the first thing that I do when I meet a patient or a new patient is really listen to them and try to figure out, again, really what they want and understand them. And once I understand, I try to relay at least what I thought I understand so that they can do clarifications. And I think when someone felt that you listened to them and heard them and again, bring that kind of starts a relationship. The other thing that I try to do is I really don't try to sell surgery on patients. I do reconstructive surgery and I do other things. So I am busy to the point where I really don't have my main goal is not really establish, try to sell a procedure. My goal is really to establish more long-term relationship with my patients, which is usually what we do even with our breast reconstruction patients, there are long-term patients. So I think if you really want to go in a long-term relationship, you really need to have a trust and maintain that trust. You call them, you try to figure out what's going on with them, and then again try to deliver when you can. And sometimes it's like everything. Surgery is not perfect. We have again things that might come in, and the patients might not feel that we gave them the best results that we could have, and it might be something that they maybe didn't understand, or the communication, or maybe I might not relate myself the most appropriate way when we did, a surgical intervention. But again, it is surgery, especially in the reconstructive arena. Can't sometimes, we're starting from a big defect, and this is what we got you to. It's better. It's not 100%, and sometimes patients lose a little bit of that. I think they lose sometimes a perspective of really where they're starting or where they're going. But again, I think maintaining communication, open lines of communication, is the number one thing for trust. And then again, the goal is really to maintain a long-term relationship with patients, and not just operate on them and see you, blah blah blah. Most of my patients are very happy with the situation that usually the first contact that they'll have with a provider will be with me, and during the recovery period and after they recover, or even after surgery, it's still with me that they're seeing. Sometimes it might be a resident, it might be an assistant or something, but it's always with me that we maintain that line of communication. And I think patients are very happy when they know that the person who's seeing them is a doctor, and their doctor is following them through. And if they end up in a hospital, at least in Miami, I have privileges in most facilities here. So if my patients end up in X, Y, or Z hospital, I will follow them where they come. And that's, this part of what happened to me this weekend. I had to follow up one of my patients that ended up admitted in another hospital. And they're happy to know that their doctor can, relate or talk with other doctors and take care of that. And that really maintains a long-term relationship. And again, we're very easily accessible. Patient has a problem or something, they can communicate with me or my office, and someone will definitely be for them. And I think that's really when they can see that there is that good trust, that relationship.
That's good. And I'm sure, doctor, that when you do a job in somebody and they refer to somebody else, the trust is already in that new person. It's instilled in that person, because they know, let's say it's their uncle or their wife or whoever it is, and they know that they trust that person, so they trust that they're going to recommend somebody that is good. So I believe that helps.
Yeah, especially if a colleague refers you a patient, you can't make that colleague look bad. So they know when they're sending you someone, you're going to really try to do, when a colleague, especially a referral from another colleague, you're going to be, those patients, you got to treat them like family, and we try to. Again, sometimes it's difficult to give them all the results and expectations that we've spoken about, but definitely that's the idea. You come in with someone you're referring, especially you or us, you refer to someone. When you're referring a patient to another colleague, it's because you trust that person, and you're trying to do it in the best intention. Hey, this guy is good at this, I work with him. And sometimes we do. There's things that obviously they're out of my scope of practice, and I'll refer them to someone, and the same thing, some colleagues will refer us. And that works. Again, patients really feel they're very happy when that a referral comes in, and again, that trust is maintained.
Yeah, but also from patient to patient.
Yeah,
right?
Patient to patient. Oh, yeah, exactly. They see the results. Say, oh, show me your breast, and they'll be, oh, yeah, I want that guy to do my breast. So it is good. I haven't been that good at with my Instagram and social media. That's why we're doing this part of it. But a good thing is we kind of do it like old school, where it's the referral, at least locally. When a patient gets a good result, you're very happy, and then they refer to their friends, and you come in and you take care of them.
Nice.
And again, you're in a community, because at least at this stage of my practice, a lot of my patients are from the local community, so you want to make sure that you take care of your local people. It's not people fly in and leave. So it's most of our people are here. We have people who come in and fly and whatever, but our local patients are very happy, and they continue referring us patients.
That's awesome.
Yep.
Nice. All right. Now, could you share an example of, let's say, a patient whose life was significantly impacted by a successful plastic surgery procedure?
Yeah, I think, we have two situations. We obviously have situations where, we have our cancer patients, our trauma patients, and our reconstructive patients. And again, patient who's had some type of devastating injury, or even in the trauma situation where we've had patients who've had devastating injuries in the face. I did a lot for 10 years. I've done a lot of facial trauma, and unfortunately, a lot of battered women and domestic violence, and we had a lot of those patients showing up to our office with facial trauma and things like that, bad fractures. And, when you're able to, again, fix those fractures and show them, where you were, and gunshot wounds to the face, things like that. I've had patients who've gotten shot. It's, unfortunately, a lot of those. And, sometimes they think, my face is going to be, my face is not going to be back to again to what, what used to be before, or they feel to some way mutilated. And we've had the opportunity of fixing them. And it's sometimes, I'm not going to take the credit. It's the trauma team, an entire multidisciplinary team, people from the trauma service to the people who we work with, to reestablishing them and getting back again to the community. Even when they come to the office, you don't recognize them. And it helps them move forward. I think in that point of view, or people who've had boating accidents, I've had patients with boating accidents that thought they were going to lose a leg or something like that. A lot of boating accidents here in Florida. And I've had patients who've shown me pictures, hey, dancing or this or that, and you're like, wow, you're super happy. Oh, I had a knee replacement and whatever. Thank you so much. You did this or this and that. And you're like, oh my goodness, people are just like moving forward with their life. So you're very happy about those things. I think in the cosmetic point, and people think only in the aesthetic, like it's only reconstructive and cancer. But I think I gave you that example, I think, when we were talking before. We run a lot into, an example that we run into is like girls who go into puberty and they're teenagers, and I think, they present themselves with breast asymmetry, or because it is out there, a large breast that is more larger than another one, or breasts that are very small, or breasts that are too large, and it definitely affects their self-esteem. And yeah, those patients definitely, when it's affecting their self-esteem, I think those are patients that are appropriate to go and have interventions, so breast reduction or breast augmentation, or something to that extent, or correcting an asymmetry or a breast deformity. And that brings up their persona up, from a girl who is completely normal, went into puberty, notices, compares herself to her friends, or she has asymmetric breasts or breasts that are too large, and now she has, locks herself in and becomes depressed, has surgery, and becomes someone totally different outward. You see how they dress, how they project themselves, how they behave, how school, everything. And definitely you see it a lot. Wow. And they're super happy about it. So I can tell you a lot of stories about situations like that, where someone who was introverted now is open. It's not that we're introverted, it's really that, they were going through a lot of those internal issues that were happening to them. And we can definitely help them with that.
That's really good, man. That you get to do that, and that you get to be such an impact in people's lives. Now, as a plastic surgeon, how do you address ethical considerations and the responsibility of enhancing people's appearances?
I will tell you, if I would think that plastic surgery wouldn't be something ethical, I wouldn't be in that business. I think we definitely help a lot of people. In reference to what would you consider unethical or ethical, I think it's not so much. Because again, I think people have, if people have autonomy, and it's your body. You can definitely make the decision if you want something. I'm not one to judge you if you want to do something to your body. I think everybody has that autonomy. I think where I draw the line is what I can deliver and what I feel comfortable delivering. I think if someone tells me, hey, I want this. I think last time we talked, someone asked me about doing them a tail, and I was like, wow, that's interesting. No one asked me to do them a tail. I really don't have experience on that, but at least let me think. Someone asked you to do them a tail, but we ended up as a joke on it. We never, nothing came out of that. But what I was going to tell you is, someone asked me about something. At least I will be humble with it. I really don't have I can't really do those things for you because I don't have that expertise. There might be someone who might be able to do that, and I can refer you to that. Again, I believe everybody has an autonomy in deciding. I'm no one. My job is not to judge people; is to help them. So I really kind of move forward with that. I'm busy enough to worry about those situations. I think if you ask me, if someone comes in a situation that might be unethical, that we definitely look, and plastic surgeons, especially in Miami, look into is domestic violence, and again, human trafficking and those things. If someone comes in and it's it didn't happen here in Miami, but I did see it once in our training, and when I was training in Indiana, and the attending brought into, and he said, like, I'm not touching that girl, and he brought that notation, says like that there is something in with the relationship where the girl is not talking, or the patient is not talking, and there is a manipulative partner that is telling me to do those things. I really try to walk away from the situation or even figure out what's going on in that situation. So we do run into those situations where there is something. And again, if I do suspect that there is something that needs to be, again, if we feel that there's something that needs to be investigated, there's violence or something to that extent, that's obviously our duty to report it. I haven't run into that situation, but I'm definitely aware of it. And being again, when I meet with the patient, it's usually I'm like Sherlock Holmes. I'm just trying to investigate what's going on. I really want to know what are your motivations to have surgery, because again, that's one of those things. What do you want, but really what's motivating you to have that surgery? Because sometimes what might motivated you might not be, I might not be, by doing the surgery, I might not be correct in what's motivating you. And you know what? Then I'm still going to end up looking as a bad surgeon. So sometimes you got to really find what the reason of the surgery is. So sometimes in those communications, we'll find out, hey, maybe surgery is not the right thing for you. So sometimes it's a medical problem that you're having. We have to correct that problem before you're having surgery. So again, into that same situation, again, you have to be a doctor and you're talking to the patients and figure out those things. But I think that's where I would come into the ethical part. I think patients are autonomous. They make their decisions. And if it's something I can do, I will refer them out. And again, we're looking out, or at least I'm looking out for violence. At least those are kind of my check marks, or where I would, in my working knowledge of the day-to-day, what I'm doing.
Okay, yeah. I mean, I'm guessing because you've seen that it happens a lot, right?
Yeah.
Now, what challenges do you anticipate that the field of plastic surgery is facing in the coming years? And how do you think they can be overcome?
Man, plastic surgery, I think I don't think we're going to be replaced by robots, at least in the next time soon, because every time guys, doctors are going to be replaced. I think technology is something we got to be embracing, but I think definitely I don't think at least plastic surgeons won't be replaced immediately. I think the tools and AI helps a lot with, we did 3D imaging and a lot of the things. I think that artistry of a plastic surgeon, I think we're definitely a little few years behind, ahead from that. So I don't think at least that doesn't worry me in that sense. I think one of the things, again, with technology and everything, again, those are tools. And I think I had mentioned, tools can be used for good or for bad, or at least, it depends on how you look at things. Social media, again, is one of those things that definitely has opened up plastic surgery, and people have become more open about plastic surgery. What for us, for plastic surgeons, is a good thing, because I guess it makes us more available, at least for us from the business point. I think it's more available. I think, again, the problem is with social media and people who aren't trained or again, have that, there's going to be vulnerable people or vulnerable populations, and sometimes that can definitely lead to bad things. How people in the self-esteem when you have so much exposure, because I think social media and images only show the positive of things, and sometimes people feel like themselves like, I don't look like this, or I can't look like that, and then definitely it makes people feel bad instead of better. Like, even as me as an adult, I tell my kids, I don't even use the social media. If I use it is because I have to work. But if I had to see social media and I see that all my friends were on the 4th of July having fun, meanwhile I was in the hospital working, how do you think I'm going to feel? I'm going to feel miserable, And I'm an adult and I'm conscious about it, but I still know that somewhere in my brain something is telling me, oh man, you feel like, oh my God, I should have had fun. I was working. But and that's me, an adult, being conscious. I tell you, imagine what's going to happen with a 13-year-old, a 14-year-old kid or a teenager, is trying to compare herself with another girl, blah, blah, blah. There's definitely going to be a bad situation. But again, I think it's a tool. I think if we look at the positive things, again, social media and all these things have definitely made it more available for people to see imagings. And again, information is more easily shared. So I think in that sense, it's a good thing. As per technology, I think newer technology is going to definitely come in, artificial intelligence, 3D imaging, mapping, all of these things are going to definitely be things that are exciting in the breast in the reconstructive arena. I think, newer technologies with tissue engineering and all those things, I think, are things that are going to be super cool. I think we're not going to need to be taking parts of your body to put it in other parts of the body. That's called a free flap. But when we move something from one place and put it in some in other parts of the body, I think eventually we might get into tissue engineering. Well, we might engineer it, and yet then we're going to still have to connect it and plug it into you. But at least we're not going to have to take it from you. We might be able to make it somewhere and then put it and connect it.
So you need at least like the DNA of the patient to.
Yeah, no, you can use your own tissue or something and
So
do the regenerate tissue. People are working with hair follicles and things like that. So for us who are getting, we're losing our hair, I think that's going to be a great thing. If
I'm there with you, brother.
Exactly, exactly. So I think that's going to be a good one. So yeah, technology, I think it's definitely one of the things that we embrace. I think minimally invasive surgery in the reconstructive arena, the robotic surgery is something that plastic surgeons are maybe a little bit behind. The urologists, the gynecologists, head and neck people are definitely, eons away in what ahead from plastic surgeons. But in the reconstructive arena, that's something that I would like to definitely explore how, super microsurgery and all those things with the robots are going to be something that are going to be fantastic.
Yeah, that's interesting and scary at the same time, right?
Yeah.
Now, are there any misconceptions or stereotypes about plastic surgery that you would like to debunk or clarify?
I think, I think with plastic surgery, that the typical stereotype of who's having plastic surgery, I think that has changed. I think we've definitely become more open. Society is more open about plastic surgery, and I think that is, at all, age groups and even, genders. Everybody's really operating themselves. Men, which I think if you were a man used to be more quiet and really wouldn't have intervention, and everybody would say, and even women would try to do the surgery and really try to cover themselves and not say, oh, I didn't do surgery, and deny. They had plastic surgery. I think everybody is now having surgery and they're open about it. They show it, they talk in their experience, people blog about it. This is what I did. And definitely, I think that stereotype of who's the person having a plastic surgery, I think that's definitely changed. I think obviously depending on who you are and what type of, where you live or your demographics or where you come from, then you're going to have, you're going to be inclined to having some type of surgery, But as a stereotype for the type of surgery, I think that definitely, I think we're more open, the society is more open on who's having interventions. And I think everybody is definitely, you have the technology, why not use it? If it's going to make you feel better, look better, I'm good about it.
Yeah.
What I was going to tell you is that I think the stereotype of who had plastic surgery or say she's the made up, I think that look is definitely changing. I think people, at least at this point, I think, from going to, I want the big breast and I want to look made, like I want everybody to know I have plastic surgery. I think at least I feel that the trend is going into, I want to look a little bit more natural. So I think, I think the trend is more girls want smaller breasts, maybe that BBL that they had this big butts. Now they're going into, okay, I don't want a leader in each gluteus. I want maybe, I want them to look natural curves, but I don't want to have this butt that, looks like I have two balloons in my butt. So I think that unnatural fake appearance is definitely changing, what's the name of you remember, I'm trying to remember who framed Roger Rabbit. You remember Jessica Rabbit? What was the name of the character? You remember that character? In the cartoon, there's girls who,
dress?
Exactly. That's kind of what I used to be, the humongous breast, the body, the curves, and I think that is definitely changing. And again, that was a trend. I'll tell you, there are people who really want to look like that, and I think that that's a stereotype. I don't think that is definitely changing. I think girls want to look more natural and again, more athletic. I think that would be the trend that I feel in South Florida is a natural athletic look.
Nice.
Yep.
Now, I mean, yes, talking about the big butts. I mean, you see that a lot now. I mean,
Yeah.
So are you saying that trend is already like fading away?
I think not as big as before. I think the exaggerated look is definitely probably slowing down. Again, it's more of an athletic. I want them to look. I want it to be part of my body. I want the butt to look like part of me. It's not like, you had a girl and then you had this big butt and then very thin legs. You just had liposuction of everywhere, and then you have this thing that is not congruent with your body. I think that's definitely change. I think the idea of having a nice, shape or a derriere is something that you wanted to be balanced with your body. And I think that's where I think patients are looking again more for that balanced appearance, more of that athletic look.
I mean, and I think that the Kardashians, I think they brought that because a lot of people wanted to get that big old booty like the Kardashians.
I will tell you, I think in part that they probably did something. I think we have to give that credit maybe to Jennifer Lopez. She was probably the one who brought it in before, and then from Jennifer Lopez, it went working the way it's down. But I think, gluteal augmentation and gluteal enhancement has been before. I think just in the United States, it was maybe brought in, like you said, the Kardashians, and maybe she brought it in. And when she did that thing, and there was a picture of her, like I think in the New Yorker or something, and it like broke the internet. And it was like, oh, it's incredible that, that came in with those things. And that look, I think at that point was definitely something that a lot of people were looking into. I think that look has definitely, again, is softening and trending down into probably, a little bit more a natural look. But I think at that point, that probably was what definitely brought it in. But before, I think girls really didn't want to do that. I think that now, I think, and again, as more Hispanic and more of that ethnic appearance into the American society is accepted, I think we definitely, girls are looking into that. I think before, when I did my training a little bit more than 12, 13 years ago, when we were in Indiana, I think the look that we had, girls in Indiana were like, want my breast, and I think everybody was really concentrated. The Americans were in the Midwest, where I trained, was really more, breast enhancement. That was it, thin, big breast, and that's kind of what if you look at, the videos of the 80s and whatever, the rock videos, and you have those girls in the bikinis, and they have, big breast, flat butt, it's like, oh man, what's going on there? There's something missing here. That's definitely changed. Now it's, a little bit more balanced breast,
proportion,
more muscle. Girls have definitely want to look more athletic, they want to look athletic, muscle, and then that butt that looks athletic, muscular. I think definitely that's where we're going with.
Yeah, I mean, it's a decent look.
Yeah, I won't complain. I think no one's really complaining about the look.
Now, in your experience, how has social media influenced? We already talked about a little bit about that, but let's dive in a little bit more. How has social media influenced the perception of beauty and the demand for plastic surgery? How do you navigate this influence in your practice?
Again, it has had positive, a positive. You can say that there'll be arguments for positive and negative connotations wherever you look at things. I think social media definitely has brought it available to that people realize that plastic surgery and somewhat, I think, created the illusion that plastic surgery is something that everybody can have, and the illusion that is, I went for surgery and I recovered, and there's no recovery period at time, and I had surgery and I looked beautiful immediately. And it's probably sometimes made plastic surgery a commodity. They think it's something instantaneous, and sometimes leads to false expectation. But let me tell you, at least from the positive things, I think definitely social media, even for plastic surgeons, has definitely allow what we do to be exposed there. I think has the fact that there is so much exposure to plastic surgery there has made it more acceptable. I think people were more hush-hush before that they were in surgery and trying to, not say, oh, I did it and blah, blah, blah. And at some point, I think, not now, but I think some people were really weren't really, wouldn't feel comfortable admitting that they were having plastic surgery. So I think the fact that social media and all of these trends have changed. People have accepted, this is who I am, and aging, and I feel comfortable who I am, but I want to have plastic surgery to do so and so. And I think that's definitely, and it's acceptable. Hey, they went and did plastic. Oh, yeah, I did a tummy tuck. I did lipo, blah, blah, blah. Now I look good. And that's a man. Wow, this guy went and accepted it. Perfectly accepted that you went and did, acceptable that you did surgery. Negative connotations, again, I think what creates with the challenges sometimes is that people come in with false expectations. I think that's one of the other things. And sometimes it, depending on who they're following or who they're getting their information from, they don't get the full spectrum of really what an intervention is. And sometimes you have to talk to the patients and tell them, doctor, this is not Dr. Google. This is how things work. You have surgery, you're not going to recover immediately. You have liposuction. The more liposuction you have, the harder your recovery is going to be. You're going to be in more pain. The more downtime you have, the more purple, the more bleeding you're going to have. You're going to have the surgery in the hospital. You're going to have blood loss. These things. You might need a blood transfusion, etc. So those are all kind of things. There is some type of breast cancer association with breast implants. You tell them all those things to patients. The patients say, "Well, I never knew. No one told me this," or something. So again, when a patient's making the decision for surgery, we go over that laundry list of pros and cons and seeing if you're really accepting to those things. And again, surgery, some of those changes are irreversible. They're permanent things that you are putting yourself at risk. And sometimes I think social media doesn't accentuate on that. It just accentuates, I'm going to have surgery and I'm going to have a lot of fun and I'm going to make a lot of friends after I have plastic surgery. And again, that sometimes doesn't happen. You have plastic surgery, you were depressed, and now you don't like how your breast looked before, and now you put implants and you still don't like how your breast looked, and you're still depressed. So you find yourself with all those kind of things that that make it sometimes difficult, again, to deal with patients. So I think social media definitely has good things, and again, there's some things that sometimes when you're talking with the patients, you have to debunk on those things, clarify things.
Yeah.
Yeah.
Okay. Well, doctor, I think that's all for today. Thank you so much for your time.
No, thank you so much.
Yeah,
that was a good chat.
Yeah, definitely very informative, and I hope to see you next time.
Okay, sounds good. Plan.
All right.
Thank you so much.
You got it.
All right, bye-bye.